Good evening to everybody. Now it's evening. We started in the morning. This presentation is going to be something totally different from the presentations and things that we have heard today, because I come from the health sector, and the issue is what public health sector can do with all these measurements that we have heard now, and what is actually our engagement in monitoring PM concentration and heavy metals in PM. We focused in this work. We focused on the industrially contaminated sites as a team that is working in our Institute of Public Health of Serbia. Has worked for some 5 years on analysis of the contaminated sites in Serbia. As we see here in the map, we have a lot of them, and they're mostly of mining and smelting of copper, lead, and gold. Then we have open pit mines for lignite, which is the least quality coal that you can find ever. Then we have a lot of lignite firing power plants, cement quarries, and plants, cement plants. These are actually the sources of PM particles in Serbia. And due to these activities, we have a lot of air pollution, wastewater, soil contamination. It is important also for air quality, because the contaminated soil then has some consequences also on PMs. And we have hazardous landfills also with toxic material. What were the key objectives were to show what are potential public health hazards of heavy metals at industrial contaminated sites. And actually we analyzed in the Institute of Public Health data on nickel, arsenic, lead, and cadmium, which are measured in the particulate matter in Serbia. But as indicative measures, it was like done like a cross-sectional study with results from 2020, from last year. And naturally, not all of 25 institutes measure heavy metals in PM, which is also just a handful of them: Belgrade, Požarevac, Pančevo, Zrenjanin, due to the industrial pollution. There we can see that actually arsenic is the element that is of most concern, public health concern in Serbia. I would not elaborate the others. So we see again, we stumble upon bore, and the largest mean annual value for arsenic in PM is naturally in bore. It is a lot times more than it should be, of 6 nanograms per meter cubic, and it was in last year it was more than 130 nanograms per meter cubic. Actually, I also would like to mention that actually it is a copper mining and smelter community, and arsenic is also higher than it should be in two small towns where we have petrochemical industry. So we have mining and petrochemical industry are key sources of arsenic. Now we I won't go elaborate. Institutes of Public Health cannot do this job so perfectly. There are a lot of gaps in the functioning of local institutes of public health, which is the reason why we just seldom measure these heavy metals in PM, and usually they are of indicative nature. This is actually the key point of this post-presentation. This is the distribution of arsenic in PM10 in last 10 years. And you can see that when we quantitate these quantities of arsenic, we see again that it is bore. And also here we have some coal lignite firing power plants. So gaps for these measures that they are indicative, so we do not have enough. Actually, we do not have enough data, and until now we did not have any health impact assessment for bore until now. But how actually does the public health sector cope with this? Well, we tried together with Visha, who is very popular today. We took him in our team as a key expert from the Institute in Bor, and actually supported by UNEP, SAICM, and WHO and our Ministry of Health, we did a very useful project where we tried to strengthen the Serbian national capacities to try to do something with contaminated sites. We did have people from the Ministry of Environment Protection and from SEPA also doing this project with us, and actually we did make some movements, which is that we may produce a roadmap for sound management of contaminated sites, made a gap analysis, what is happening actually, what are the gaps in managing contaminated sites, and made a publication with the Bor study. Why the Bor study? Because in the assessment of health impact assessment that WHO has made and published 2019 with these results, actually there were no results of Bor, because the results were not consistent. And then we made an epidemiological study because the results of measurements were not continuous and we did not have a lot to say about what are people dying of. So we went through our cancer register, and I won't go much, you will have this presentation. The point is that actually for all malignant tumors except skin tumors, there is a significantly higher risk of acquiring disease in both men and women in Bor. We had a reference population of southeastern Serbia as a control study, and actually all cancers, specifically lung cancer and bronchial cancers, were very dominant in both genders, which is very important because it means it is not occupational exposure, it is exposure by living there. We know that we cannot say that is the only reason, but actually we know that something has been happening there for some 100 years. So according to these results, we have to plan some other steps. And as we saw, RQ Plus is coming into action here in Serbia, but we are not satisfied with this individual use of Air Quality Plus software, so we are planning to make it through the system, to make it like a bylaw that each public health institute has to make a health impact assessment of air quality through Air Quality Plus, and we have to work harder with other key stakeholders and to also strengthen all the capacities to work for managing contaminated sites specifically. Also, what was finished just on Friday, I was leading this project. We did a project strengthening of national capacities for assessment of chemicals risks to guide risk reduction decisions. What does it mean? We gave a draft of all methodologies for health risk assessment that have to go into a bylaw. So there should be a systematic approach for health risk assessment from chemicals, and if WHO also acquires that air pollution is chemical per se. So in a way, we are going to put it in regulation, in legislation, that we have to take account the health risk assessment. And also in this project, WHO made us choose one single chemical that is going to be of most public health concern. Consensus of multi-sectoral experts said it was arsenic. Actually, because we do have it in water, we do have it in air in some places, and so we will slowly through focusing on arsenic, we will then do other heavy metals because the methodology is similar. And this is just a picture to show how we are all surrounded by chemicals and why it is important. And when you read this in the box, then you also know that we are demographically very poor in Serbia, as most of Europe, and all these heavy metals influence very much what is the offspring going to be, and some of the heavy metals are also endocrine disrupting compounds. That's for me.
Thank you, Branislava, for this presentation of this very important topic. We have a question here.
Have a question? Excuse me? Ajde, prvo tamo u chatu.
Nemam ja ovdje chat.
Koja tehnika?
The
What
question
technique
was,
is used to
what
measure?
technique was used for measuring heavy metals?
Samo-
Somebody in the chat asked that.
I think Houston, yeah. Romania.
These measurements were done, the results were taken by the SEPA, actually. These stations were held by SEPA, only the Institutes of Public Health held them, so it comes from the automatic measuring stations.
Okay, yeah. My question is first about arsenic. As you show in these graphs, it is problem in the bore. But I don't know where is still. And also about arson in water, that is something completely different. It is natural things in city of.
No, but actually.
It is in city of Zrenjanin. They are far one from the other, and yeah.
Not only
The-
Zrenjanin, actually,
In?
when you look at the map, because one of our
In water,
assignments
yeah.
in water was to map, to go, to choose one chemical and then to go to all media.
Yes, nice.
And then to map them.
Yeah.
And when you see the joint map of all spots where you can find arsenic, both in water, in soil, and the map with soil is so tragic that you have tens of spots where you cannot even remediate.
Okay, we can.
So, I mean, that is why we chose arsenic, because population in Serbia is exposed through arsenic through at least 3 media.
In other media. And also, you put it there only cities that are industrial cities.
No,
and
we
what-
also, there was a map, on that map you had small spots where arsenic is also sampled as urban arsenic. So you find it also in some Belgrade streets, in some other streets, some other towns, but
But
you,
it is not to compare with situation like it is in Bor.
no.
So it is not comparable because it is logarithmic scale,
No,
because it is problem in air of Bor and sometimes somehow in some other cities, but it is not comparable with that because it is so. If we put logarithmic scale, then it can be.
Something totally incomparable.
What I want to also suggest and ask the cities where it is some study about heavy metals and not other pollutants, because a lot of pollution, particularly in Pančevo, come not from any metals, but it's come from local sources of heating, and this is something that needs to be taken account, how to be classified, and that is not in, I don't see that in this study. And also there is a lot of concern in media and everywhere about something what is at, not even here in Serbia, but in at Cerovo, at Užice, but all of us know where that cities are located. They are located they're around the higher mountains, and it is not possible to be different situation. Only what can be improved is to eliminate local sources of domestic heating and nothing more, and then that needs to be done to be solved in different way, and not to talk that I don't agree with that because that is something that is for years. I remember for many years ago when go on very often on skiing at Jahorina, that is very near to Sarajevo. All was the same for the years, and it's depend of not something that is from today. It's depend from years and from.
Why we focus on heavy metals is that our suggestion to the government, to the Ministry of Health, is to let us put into a system human biomonitoring.
Yes, but
And-
it is also necessary to be put biomonitoring not only from metals, but also from that organic compounds. If we are going to look in how many population live in Bor and how many of them live in in areas where we have that organic compounds, I think that it is more people that are
As a chair, I must intervene. Thank you for this very intensive discussion.